Tonight,
making progress against COVID-19.
The measures we've taken so far are working.
A look at the new models released by the federal government. Plus, preparing for a second wave.
We know for sure that this is not over.
RVH begins to increase its critical care capacity. And helping the homeless during the pandemic.
We are creating safe spaces for people that are experiencing homelessness.
What's being done to ensure their safety?
CTV News with Candace Daniel.
We are observing slowed epidemic growth and a leveling off of epidemic trajectories across most jurisdictions in Canada.
Federal ministers release updated models for the COVID-19 outbreak, showing the spread of the virus has leveled off in some provinces, but warn we could have nearly 67,000 cases by next week. Good evening, everyone. As the number of daily COVID-19 cases appears to be descending across much of the country, Ontario saw a disheartening spike today after 3 straight days of declining numbers. 525 new cases brings the total to more than 15,951 people have died. And 951 people have died, 59 since Monday, which is the most recorded in one day. Nearly 9,000 cases are recoveries. In Simcoe, Muskoka, 2 new cases raises the total to 261, including 15 deaths and 144 recoveries. In York Region, 28 new cases today for a total of 1,458. They've had a total of 90 deaths and 579 recoveries. And 3 new cases in Grey Bruce brings the total to 80, including 38 recoveries. Across Canada, we are nearing 50,000 cases and more than 2,800 deaths. The province of Quebec represents 26,000 cases and more than 1,600 deaths. The good news is nearly 19,000 people have recovered. Earlier, Canada's Chief Public Medical Officer of Health announced COVID-19 infections across the country are starting to flatten out, but there will likely be more deaths than expected. CTV's Joyce Napier has more on the latest projections from Dr. Teresa Tam.
As the countrywide shutdown continues, some good news coming from Canada's Chief Medical Officer. The spread of COVID-19 has slowed down, but a word of caution, it isn't time to celebrate.
So, until the population has developed a high level of immunity to the virus, or we have a vaccine in place, we have to plan to live with